Good morning, YouTubers. It's Dr. Danny McClure. It's hard to imagine that 2 weeks ago today, at this very moment, I was under the knife here, having my cervical disc between C5 and C6 removed with the artificial disc Mobi-C installed. Again, that was about a 2-hour surgery. I was having a lot of symptoms while both arms, hands, particularly these fingers, thumb, first and second fingers, biceps, forearms, mid-back, shoulders, neck, just lots of pain. It would be better if I would lean forward. It was worse if I looked straight forward or looked up. Wow, honestly, my pain symptoms are all but gone. Right arm is really good. Left arm, I've got a little bit of numbness and tingling here, very, very little, and just really no pain. Maybe a little bit of pain back here, but I think that's still from, honestly, just I'm healing. As you can see, I'm not wearing a bandage anymore. Let me get in kind of close and let you see the surgery side. I do have a little bit of antibiotic ointment on that. There's still a little bit of the Dermabond glue adhesive that's there, but that's kind of coming off. Honestly, when it flakes up, I'm kind of picking some of it off, but I'm trying not to pick it too much. But the surgery site looks good. Most of the redness I think we see there is actually, I think, it's the purple surgical ink that the surgeon used to draw a line for his incision site. As the Dermabond glue has peeled off, really the surgery site looks great. Yeah, I've returned to work. I returned to work 1 week ago today, and I tell you, when I returned to work, man, I just started having really good advancement in my symptom freeness, my painlessness, my range of motion. My range of motion is like crazy good. I can look down well. I look up without any kind of pains. My side bending is not as good as it probably will be. I see my surgery in about a week. I've been driving to work. I let my wife drive. Sorry guys, but let my wife drive when she's with me. But otherwise, I drive to work. A little difficult, especially when I was wearing my brace, for sure, to look to the right and see the right oncoming traffic. I usually turn right and kind of look back to the left. I'm sorry, when I look to the left. But now I just kind of pull straight forward and I'm able to see traffic okay. I just kind of take my time. Things are going well. So glad that I had this surgery. First week was the worst. First day of surgery was the worst, obviously. First week, I just wasn't doing that much, and for me, that just makes pain worse. So I got up and started walking in the mornings now and doing a few little just squats, a little exercise stuff, not with any kind of weights, just my own body weight, and just feel a lot better. So I'm glad I had the surgery, and I had the Mobi-C device that was installed, and I guess if anything I would change, I would have had it done earlier. But looking back on it, I think I kind of made all the right decisions at the right time. So hope this helps for all of you guys considering cervical disc surgery. There's the option of having the disc removed and the bones fused together. I'm not a fan of that option. Sometimes it has to be done. I think the better option is in between the two vertebral bodies, the two vertebrae of the neck or back, low back, having the replacement disc placed there. So talk about that with your doctor, do your own research. As a physician, I know my patients have a lot of say in the decisions that they get to have. It's their body, it's their life, it's me that's kind of making the recommendations, but if it's not wrong, I really allow my physicians to my patients to make their own choice. And I think that's a good guideline for all of us. If it's something that you want, and if the surgeon can do it, then you need to let that be known. So for me, I chose the Mobi-C. I think was the best device, and glad I had it. All right, guys. Hope you're doing well. Comment below if you like. I'll update another video maybe in a week or two, and just to let you know how things are going. But day 14, things are great. Have a good day.